Welcome back. Still sticking to the tone of health conversations on this Tuesday morning. While some people choose circumcision for health reasons, others do so based on cultural or religious beliefs, making it a topic that is both medical and social in nature. Joining us this morning is Dr. Puye Jonah, a general practitioner here to speak on male circumcision. Good morning, doctor, and welcome to the show.
Yes, good morning.
We're so delighted to have you, but let's start with the basics. When we talk about male circumcision, run us through what exactly this procedure is and why it is so particularly important.
Yeah, so the right term is voluntary medical male circumcision. So in short, VMMC. So that is the surgical procedure where we excise the foreskin. So the foreskin is what covers the penile head, and it's done under aseptic condition. It's a surgical procedure, so it's done by a medical professional, and yeah, it's got a varying benefits, as we'll get to know.
And what are some of those varying benefits?
Yeah, so the benefits is hygiene. So it makes maintaining hygiene a little bit easier. It's also, as you said, religious purposes, as well as medical. There are medical indications, conditions like phimosis, paraphimosis. I'll not go in details about that really, but the other ones are prevention, as part of prevention of HIV transmission, as well as other sexually transmitted infections, and also reducing transmission of the human papilloma virus. So in a way, it also helped to reduce the risk of the development of cervical cancer in our women. Yeah.
I think what people may not really understand is exactly how voluntary male circumcision aids in preventing diseases or ailments such as HIV. How exactly does that work, doctor?
Yeah, so it actually reduces the risk to about 60%. So research shows that they are, like the HIV virus, enters the penile glands more easily through the foreskin. Oh. So by removing that, we're actually reducing the risk. And then obviously other now sexually transmitted infections. Yeah. Some of these infections thrive under, like, let's say, under the foreskin.
Yes.
Yeah.
The environment enables
the environment aids some of these infections. So yeah.
That's quite interesting. But let's talk a little bit about the difference between the medical and religious aspects when it comes to voluntary male circumcision. Could you help us understand the difference between the traditional, religious, and medical circumcisions in terms of the process and the reasoning behind it?
Yeah. So in terms of religion, is really like a personal choice. Most of the time, the decision is made by parents when the boys are still, like, they're still babies. So it is mentioned in, circumcision is mentioned in the Bible. Just can't remember where exactly.
Somewhere in Genesis.
Yes, yes. And then traditional purposes, there are certain tribes that we know of that perform circumcision immediately, almost after birth. And then the medical indications. So this is when recurrent urinary tract infections like when there's that problem, and then also now the phimosis and paraphimosis that I mentioned. So circumcision comes in as a solution to those problems.
I see. And there are varying myths surrounding male circumcision. From your experience as a medical practitioner, what would you say are some of the most common misconceptions you hear when it comes to male circumcision?
So I think one of them we associate it with being performed only in winter, uh, which is not true because as I mentioned, this is a surgical procedure.
Yes.
So just like any other surgical procedure, it is performed under certain like aseptic condition. We make sure that the procedure is safe. So it can really be performed during any time of the year. So it should not only be performed during winter. And the other myth is that, well, it fully prevents against HIV transmission. So circumcision is false because circumcision is part of the efforts of reducing the transmission of HIV. So we still go back to the ABCs, which is abstinence, condomizing, and then being faithful to one partner. And yeah, so it complements that. So these are some of the myths.
Is not the single
Yes.
way to stop it entirely.
Yeah.
You still have to stick to the ABCs. But is there an ideal age to be circumcised, or can it be safely performed at any stage of life?
I would say it can be safely performed at any stage of life. This is medical surgical procedure. So we obviously take all the factors into account, make sure that the procedure is performed under safe and aseptic conditions. But certain countries have different guidelines. Some would say from the age of 15, some would say from the age of 13, but it can really be performed at any stage of life.
So even if,
especially when there's medical indications
that it's necessary.
Yes.
But let's talk a little bit about the gentleman watching this morning that is considering a voluntary male circumcision. What should they expect before, during, and after the procedure?
Okay. Before, it's really just making an appointment or booking for the procedure. Making sure that, so there's certain procedures in place, like filling in the files correctly, doing the initial checks, like the vital signs and so on. So things like that. So, and then taking a thorough history, because that aids us in being able to assess whether this procedure is suitable and is safe for this individual. So literally, so during the procedure, it is a pain-free procedure. It's performed under mostly local anesthetics. So in short, patient is cancelled, and then after that we go in for the procedure. Local anesthetic is given, and then we perform the procedure. It is pain-free. It takes about 20 to 30 minutes, and the local anesthetics can last for about 4 to 6 hours. And upon discharge, we obviously do all the check. We monitor to make sure that everything is fine. You have recovered well from the procedure before we send you home. You're not allowed to drive though, so you should arrange for somebody to drive you, not because of pain, but just because that you have received like some sort of anesthetic.
Yes.
Yeah, and then we advise on recovery and then the follow-ups.
And what does that recovery process look like? The recovery process.
All right, so the recovery process, it takes about, let's say, 6 weeks, about 6 weeks. It all depends on, each one heals differently, but on average, men should be able to get back to normal work activities within 7 days or within a week. But we do advise against sexual intercourse or any form of masturbation for about 6 weeks. So that's a month and 2 weeks. Yeah, so we look at the immediate things to look out for, especially within the first 7 days, which are things like these are normal for any other like procedure. Things like maybe bleeding, or look out for any redness or any excessive pain. Really, the pain should, if the procedure is done correctly, the pain should not be excessive, surprisingly, you know. I've experienced this with most of my patients, like, oh, it's not so bad,
Contrary
you know?
to popular
Yeah,
belief.
contrary to popular belief that, oh my goodness, it will be so painful and all. So it's not so bad. And then, yeah, so literally, yeah, so healing, I'm not going to go into stitches falling off and all that, but yeah.
But it's pretty straightforward, essentially.
It's pretty straightforward.
Doctor, thank you so much for your time and for providing us with those very essential insights on this Tuesday morning.
Thank you so much.
That was Dr. Puya Jonah, a general practitioner, unpacking voluntary male circumcision as well as its health benefits and the importance of making informed medical decisions. Do stay with us right here as we cross over into our third and final hour.